As the economic challenges deepen, many Kenyans find themselves struggling to meet even the most basic needs. Among these, healthcare stands as one of the greatest casualties. In the rural heart of Oyugis in Homa Bay County, the weight of this crisis is felt most acutely by the vulnerable, the elderly and the poor. But amidst the struggle is a light of hope. God will provide. An initiative rooted in compassion brings healing directly to the community's doorstep. Through door-to-door care, medical camps, and the establishment of Beryl Hospital, God will provide has become a beacon of hope for the ailing.
We are not running just a private hospital. Our hospital is a mission hospital, and we want to reach out to people. You know, like in the community, we have some deaths which should not be there. People are just dying because somehow it's negligent and somehow it's poverty. Somebody wants to get treated, but they cannot reach out to the hospital. And they fear, if I go to the hospital, who will pay the bill?
The home visits are important because some of the patients who, like one we have today, they are not able to physically walk. It's not easy. One, because of economic challenges, financial, and some of them, when they get to the means to get to the hospital is a challenge. So when we are called upon, we see the need to come in. Then also another reason why the home visits are important is because you are going to check on the continuity of how they're taking the medication, if they're on them, and if they have enough, and if they need to be checked up again, just to monitor their condition. So that will really help. And also you get to interact with the patient. Maybe there's a new development in her illness. You'll get to know maybe she has taken a long time without going to the hospital. So that's why we see it's important to have home visits. We have our NHIF cards, which is most of the people in country use it, but some of them here at the ground, when you come and you interact with them, they can't afford that 500 shillings. They have to pay to go and see a doctor or a healthcare provider. So they are not able to pay that monthly because whatever they have, they are working to see how do they eat, how do they survive for just one day. And also maybe the means of transport. Some of them, they have been amputated their lower limbs. Some of them, they're not able to see. So before they get a person to take them to the hospital and then bring them back, it becomes a very big challenge. So they just sit and they're in their homes. Their condition might be worsening as they sit in their homes without being monitored.
For the elderly, these home visits are often the difference between life and death. The visits provide care, comfort, and a renewed sense of dignity.
As some of our clients or some of other patients who have chronic illness, they might just associate it with what they have been treated of. Maybe they have diabetes, maybe they have hypertension. But when they get other new complaints and they don't take time maybe to come to the facility, it can get worse, not because of their previous chronic condition, but just because of something new infection or a new disease which they developed and they associated with that. So just to encourage that we continue doing these home visits, and we help these patients because they always need to be helped and to be looked into.
Erokamano jomolima. Ako erokamano se sister mwira nena kaka puda tuo. Nyocha ayo hospital wecha kabeta ngima. To gibiro nena ni to kora chal nade. Agon wedo kamano. Nyinga Esther Nyango Owuor. Mano e nyinga sedhi e Berin kisiki thiedha. Samoro an maber, samoro bende tuo duogo. Koro agone Nyasaye erokamano kuom jo osiptal miluongo ni Kefa. Osetimona maber ndalo duto. Gima nyalo wacho kuome marach onge. Nyasaye ong'eyo kindwa kode. An ka gibiro nena to kendo gimiya yedhe sani. Asedhi e ward ne diriyo, pim bende adhi. Ok aneno gimoro marach. Sister ma en godo bende ohera. Olimo nyaka dalana kawuono joka mago erokamano ne Nyasaye. Nyasaye omed bedo kod nyithindo momiyagi.
I'm Jacinta Ogol, a Kenya registered community health nurse. So I work at the facility level and also at the community. So today we've come to visit some of our clients at the community level. We are doing home visits. At the end of the day, when I've completed my home visits, when I go back home, I just feel happy because I've given my clients hope, and I've put a smile on their faces because, yeah, they have hope that there are people out there caring for them and those who can come to visit them.
For those unable to be reached by home visits, God will provide host medical camps in some of Kenya's most remote and undeserved regions, such as Turkana. Local communities in Nyanza region also greatly benefit from these services. Hundreds of people, from young children to the elderly, receive free health care at these camps. For many, it is the golden chance they have to see a doctor. One such patient is Deborah Akoth. Coming by foot miles away, Deborah knew that her opportune moment had come. She had been ailing for 1 week and was unable to access medical supplies for her chronic condition.
Kwa majina naitwa Deborah Akoth. Nimetoka huko Megua nikakuja hapa nipate matibabu, nikapata matibabu. Sasa hii nimepata dawa. Nilikuwa na pressure na nilikuwa na kohoa na maumivu kama homa. Sasa nimepata dawa. Sasa naona kama niko sawa.
I'm Christabel, a clinical officer at Beryl's Medical Center. So today we are having a camp. We came at 8 a.m. and the turnout is that big. We've interacted with so many patients, especially the old age, who have complaints of arthritis. Some have chronic illness like hypertension, diabetes, but they are unable to get the medication. So we've counseled them, we've treated some, given medication, and given advice. We are also going to do a follow-up to those patients so that we ensure they continue taking those medications to avoid complications.
Today, hundreds of patients walk away with a medical kit in their hands and hope to face another day. But for some, a single visit is not enough. More serious cases require further treatment and hospitalization. This led to the establishment of Beryl Hospital. Named after a young vulnerable girl, Beryl Hospital was born out of tragedy, but now saving countless lives.
Me and my brother Johnny, my partner that we work with from the United States, he was here in Kenya, was visiting. When he visited, I think we went and visited one of the hospitals within this region of Oyugis. Fortunately enough, we met with a young lady, a young girl called Beryl. And this girl was having some issues. She was HIV positive, she was an orphan, and nobody was there to take care of this girl. So we chip in as the father of this girl. And then unfortunately, this girl passed on after 2 weeks, which actually affected our feelings about how orphan children suffered when they don't have good care, whenever they stay with their extended families. So this led us to build an hospital, because being it was in our mind, we thought it was now wise to reach out to the people and to build something that will help other children who are similar problem like Beryl. So we end up building Beryl's Medical Center, and now we have an hospital. And this hospital has been actually supporting the community, entire community. We support many people. We support children with sickle cell. We support like the elderly who cannot support to themselves to pay the hospital bills. We do outreaches. We even go and visit patients at their homestead, those who cannot manage to come to a hospital by themselves. So what I can say about the project that we are running, that it has been a blessing to our community and more so to the country, because we don't just work within this region.
My name is Lucy Mombi Ukelo. I'm the administrator of the Rails Medical Center. It's a hospital in this area called Dol Kodera within Oyugis. We serve a good population. It has about 4 locations, which serves about 5,000 people. We also have other people who come beyond Oyugis, even as far as Homa Bay town. So we are here to serve every person who comes in. We offer various medical services, like one of them. We have outpatient, we have inpatient. We have the MCH where we serve the children's. We have the antenatal care. We have the maternity, it's part of the inpatient. We have the lab services. We have also dental services. Ultrasound services, it's part of the imaging, which we are still working on and building. With time, we are going to offer different services which are required in that department. As we grow, we still hold on to doing the medical camps, which brought about the birth of this hospital. We still do visitations at maybe home-based care, where we are called upon, where there is need. We still continue doing the same, so that we don't forget what brought about this. Our vision, as it says, is to treat all people in this healing ministry of Christ.
I'm taking vital for blood pressure and for temperature, which I found is normal. Systolic 120, diastolic 80, temperature 36.8. Our goal is to treat our patient so that proper treatment and proper care for our patient. And also we collaborate. If any case we have emergencies, we do emergencies, we do quick emergency to our patient for quick healing. And if any case of referrals, we collaborate with our team for easy referral, so that we don't do delayment to our patient. And that's our aim.
Tagoni wuna sitani rokamana. Main director. Kana adonyo kadi mara boro, no tim na thieth. Nyaka kawuono podi timo na thieth e Berins ka. Berins waka othiedho ji maber. Dakteche mantiere gin dakteche mabecho molony. Ging'e wuoyo kod ji gi jotuo kaka inyalo wuo kod ng'ato ma jatuo. Kendo sama gitimo round mar thieth, gitimo e yo maber ka ok gibago ng'ato ni, kata ka ok gichagwa ni ng'ani rach ni ber, githiedho ji marom. Kendo gitimonwa thieth e yo makare kaka daktari.
My name's Vitalis Okoth Odongo. I've come here to seek medical treatment at Barrels. This is my son, Basil Godwell Okoth. He has been ill for almost 2 days. And when I reported this case, I came with him here. I was warmly received by the people working at Barrels Hospital. I was convinced at the onset that the services my son was going to get were going to be satisfactory. And I'm here convinced as a parent that since yesterday, my son has been receiving treatment, quality treatment, not just treatment, quality treatment with personnel who are qualified. So I hope I'm still here for this period until I'll be discharged by the authorities. After my child will have gotten full treatment and will be in a position to tell or to know that we came here on a slight note and we are leaving here Beryl on a very good note of medical treatment. As a resident of this place, it used to take us too long to reach Oyugis. So when I heard that Beryl was relocating from Oyugis to this place, I was impressed a lot. Because at times, as a community, as somebody who comes from right within, you can lack money to take your child. You can lack even transport to take motorbike from home up to Oyugis. But from home to here, it's a reduced expense. You don't go too much because the community here, people do not have money We have people who come here, our parents, the elderly. Some of them cannot even afford 100 shillings in a day. They can come walking, they can even board on motorbike. They come, they pay small, but when they come here, they are received. I've never seen a situation where when they come here, they go without treatment. They are warmly received. The community is very happy of Barrels being here.
God will provide medical initiatives are more than just healthcare. They are the embodiment of hope, compassion, and the belief that every life is worth saving. Today, you can help to impact a life by supporting the medical efforts of God will provide. Together, let's heal the nation.